the sterilization of surgical instruments. Welcome to today's episode, where we delve into the critical world of sterilizing surgical instruments. This discussion will guide you through why this process is essential, the main methods applied, the detailed workflow involved, and how healthcare professionals ensure each step is validated and continuously monitored. Understanding the importance of sterilization, let us begin by considering what sterilization truly means. It is not just about cleaning, it is the absolute elimination of all forms of microbial life, including bacteria, viruses, spores, and fungi. In surgical settings, this is not optional. The prevention of infections at the site of surgery is paramount. These infections are a significant cause of patient illness, extended hospital stays, and increased healthcare costs. Using instruments that are truly sterile breaks the chain of infection, safeguarding patient well-being. Patient safety is at the heart of every procedure, especially since many surgeries require direct contact with sterile tissues, the bloodstream, or internal organs. Any lapse can introduce dangerous microorganisms, potentially leading to severe, systemic infections such as sepsis. From a legal and ethical standpoint, healthcare facilities are entrusted with a duty to provide a safe environment. Failing to sterilize instruments can result in serious legal consequences and the loss of professional accreditation. It is crucial to distinguish between three related but distinct processes: cleaning, disinfection, and sterilization. Cleaning is the physical removal of organic material, like blood and tissue, using water, detergents, and mechanical action. This is always the first and most vital step, as leftover debris can shield microorganisms from further treatment. Disinfection takes it a step further, reducing harmful microorganisms to levels considered safe, though it does not eliminate all forms, especially the most resistant spores. Sterilization, however, is the complete destruction of all microbial life, and for any instrument entering sterile tissue or the bloodstream, this is absolutely non-negotiable. The sterilization process. Step-by-step sterilization is not a single event, but rather a meticulous, multi-step journey. Let us walk through each stage. The process begins with what is known as point-of-use pre-cleaning, or pre-treatment. Here, instruments are wiped or rinsed immediately at the surgical field to prevent blood and debris from drying on them, which would make later cleaning much harder. Next comes the critical step of cleaning and decontamination. This usually takes place in a dedicated area, often called the Central Sterile Services Department. Manual cleaning is employed for delicate, fragile, or complex instruments, using brushing and flushing underwater. For most instruments, mechanical cleaning is preferred. Ultrasonic cleaners use high-frequency sound waves to create bubbles that scrub debris from hard-to-reach places, while washer disinfectors function like advanced dishwashers, using a combination of heated water, detergents, and mechanical force, often followed by thermal disinfection. After cleaning, each instrument is carefully inspected for damage, wear, and proper function. Think of checking the sharpness of scissors or the alignment of needle holders. Then, instruments are assembled into sets or trays according to the specific surgical procedure. Packaging is next, using materials that allow the sterilant to penetrate while keeping out contaminants until the instruments are needed. Common packaging solutions include peel-open pouches for individual items, textile wraps for trays, and rigid sterilization containers, reusable cases with special filters. Now, we move to the actual sterilization stage. Packaged instruments are loaded into the sterilizer, following the manufacturer's guidelines to ensure proper circulation of the sterilizing agent. The chosen method depends on the instrument's material and how much heat or moisture it can tolerate. Once sterilized, the items are stored in a clean, dry, and enclosed area to prevent contamination. Proper stock rotation, such as using the first-in, first-out principle, ensures that older items are used before newer ones. Finally, sterilized packs are delivered to the operating theater or clinical area, ready for use. Main methods of sterilization. Let us now discuss the primary methods used in sterilizing surgical instruments. Steam sterilization, also known as autoclaving, is the most common method. It uses saturated steam under pressure to denature proteins and enzymes, effectively destroying all forms of microbial life. This method is ideal for instruments that can tolerate heat and moisture, such as stainless steel and glass. It is fast, non-toxic, cost-effective, and offers excellent efficacy, but it cannot be used for items that are sensitive to heat or moisture, like certain plastics or delicate optics. Ethylene oxide gas is another important method. It works by altering proteins and genetic material, making it suitable for heat and moisture-sensitive items such as plastics, rubber, and complex devices like endoscopes. Its advantages include effective sterilization at low temperatures and excellent penetration, but the process takes much longer, often 12 to 48 hours, and the gas is toxic, carcinogenic, and flammable, requiring special aeration to remove any residues. Low-temperature hydrogen peroxide plasma systems, such as those branded as Sterid, use a vacuum to turn vaporized hydrogen peroxide into a plasma field. This generates free radicals that disrupt cell structures, making the method safe for heat and moisture-sensitive items, especially those with lumens like flexible endoscopes. The process is fast and non-toxic, but it cannot be used with cellulose-based materials like paper or linen, or with liquids and powders. There are also limitations on the length and diameter of lumens it can treat. Dry heat sterilization works by oxidizing cell components. It is used for items that would be damaged by moisture, such as powders, petroleum products, or sharp instruments susceptible to corrosion. While it is non-corrosive and penetrates well, cycle times are very long, ranging from 1 to 2 hours at 160 degrees Celsius, to 6 to 12 hours at 120 degrees. High temperatures can also damage many materials. There are also other methods, like peracetic acid immersion systems, which are employed for heat-sensitive items like endoscopes, providing rapid, on-demand sterilization. Validation and monitoring of sterilization. One cannot determine sterility just by looking at an instrument. Therefore, an effective monitoring system is mandatory. Mechanical monitoring involves checking and recording the sterilizer's gauges, digital displays, printouts, and cycle parameters for every run. This ensures the machine operated under the correct conditions. Chemical monitoring uses indicators that change color when exposed to specific conditions, such as heat or steam. External chemical indicators are placed on the outside of packages to confirm processing, while internal chemical indicators go inside packs to verify the sterilizing agent penetrated fully. Integrators are more advanced, reacting to multiple parameters like time and temperature, giving a more reliable indication of successful sterilization. The gold standard is biological monitoring, which uses highly resistant bacterial spores, such as those from Bacillus stereothermophilus for steam sterilization or Bacillus atrophius for ethylene oxide gas. A vial or strip containing these spores is processed in the sterilizer and then incubated. If the spores are killed, the cycle was effective. This test is performed at least weekly, often daily, and serves as the ultimate validation. Conclusion. To summarize, sterilizing surgical instruments is a complex, highly regulated process that is absolutely fundamental to modern surgery. It requires a systematic approach, thorough cleaning, meticulous packaging, careful selection of the appropriate sterilization method, and rigorous, ongoing monitoring. Any failure along this chain can have dire consequences for patient safety, underscoring the vital role of sterile processing technicians and robust protocols in every healthcare setting. Thank you for joining us on this in-depth exploration of surgical instrument sterilization. Stay tuned for more episodes where we continue to uncover the essential topics in surgery. If you enjoy the content, please like, share, and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.